All right, we
Okay.
have started recording. So good afternoon, Webb.
Good afternoon, Rep Connolly. Thank you so much for taking some time to talk to me.
Happy to be here. It's an
And
important topic.
congratulations. Oh, I'm cutting you off already, but congratulations. At the time we're recording this, the budget was you were just coming through and getting that all squared away.
Indeed. Yeah, it was a long week and it's only Thursday.
All right. Well, I won't take up too much of your time. Let's jump right into it. So you launched. I'm going to start just by way of a subtle introduction, you launched the Housing for All caucus this past February with Senator Lydia Edwards, who we actually had a chance to interact with and speak to in our class this semester. So, and your name, to my mind, and others, I'm sure, is a little bit synonymous with housing. So, what motivated you to co-sponsor a bill aiming to prevent overdose death?
Well, it's unfortunate and really tragic that we have had an ongoing emergency, epidemic, crisis, whatever word you want to use, regarding opioids in Massachusetts. And during the pandemic, in many ways, unfortunately, this raging crisis was kind of pushed to the background while we focused on the COVID pandemic. And yet we know that the circumstances around the opioid epidemic only seem to be getting worse. And so this concept of the supervised consumption site, injection site. I know there's different language that's used, but this concept has shown to be incredibly promising. And I'm particularly struck by some of the data and reports that we've heard from places like Vancouver, where there are certain sites in this fashion that have operated continuously for years without any of their clients losing their lives on the premises. And so the bottom line is we have to keep people alive, and this is a proven way to do it. And so I'm proud to be a co-sponsor.
That is very encouraging. Zero deaths in Vancouver. We were looking at some data from Canada, Switzerland, parts of Europe, Australia, Germany, talking about how there are reductions in overdose deaths and reductions in HIV and hepatitis transmissions, and great numbers. But that zero deaths at their facility is very encouraging. Well, speaking of encouraging, how do you feel about the bill's chances now that it's been recently referred to the Committee on Mental Health, Substance Use, and Recovery?
I feel really good. Certainly, I think, this is a topic that we've pushed on Beacon Hill for several years. I remember my first session on Beacon Hill was the year 2017. And as I recall, there were far fewer legislators willing to co-sponsor it. There was even, sort of some diversion, some put downs. I remember, I won't say their name, but going to a certain legislator and saying, hey, I might file this bill, I might co-sponsor this bill, we're figuring it out. It was that point in time in the session when bills are being filed and drafted. And I remember going to, an ostensibly very progressive legislator and having them sort of dismiss it as, oh, that's shooting galleries, right? And so certainly, I my guess would be, I'll take a quick look at the list here. But that legislator is actually on the bill now as a co-sponsor, whereas 6 years ago, when I first got to Beacon Hill, many of legislators were not willing to go too close to this issue. So that's really important. It really starts with breaking down stigma. It starts with evolving our language to recognize people who are facing different challenges. And then to more directly get back to your question, I'm also very encouraged that Governor Healy, during her campaign for governor last year, was asked about this issue, and she really indicated her willingness to support it. And so that's a huge step forward as well. The legislation is being sponsored not only by Representative Fernandez, but also Representative Decker, who holds a significant chair in the legislature. So I think it has some powerful backing, and I think it's an idea that so many more legislators are now willing to take seriously and consider in a way that maybe 5 or 6 years ago they weren't open to it.
Good. So maybe some of the stigma is starting to fall around addressing these types of, you know, these are therapies, you know, necessary therapies. So are there any other challenges that you can think of that are in the way of us being able to address the opioid epidemic in Massachusetts?
I mean, I guess, the context of my last answer was entirely on the sort of state level. And so then I think, we would also have to consider and we have to address like the federal level of government. And, obviously there's still a war on drugs in our broken United States Congress on the federal level. Certainly we have a lot of hostility and lack of rationality when it comes to some of the federal courts these days. So certainly we still have to, make progress on the federal level. And by the same token, then there's the local level. And, I'm very proud to say that, I've seen a lot of support and willingness to embrace this promising concept in the Cambridge and Somerville communities that I represent. And nevertheless, there's always kind of hurdles around citing locations. And so certainly in the same way that sometimes we see some irrational reaction, the light just went out here. Not that it really matters, but in the same way that we see some irrational reaction to things like affordable housing or, recreational marijuana or medical marijuana, we're going to have to also deal with the local level as well. So,
yeah, you want to talk about NIMBYism in the housing space, which I'm sure you do think about what, you're going to face from a local level. You're saying there's going to be a safe injection site in your community.
Right.
We were looking at some.
I will say, not to cut you off, and you can always go like this if I'm talking too long. Tell me to
No,
speak.
no.
But I mean, I remember Mayor Curtatone in Somerville was, had been very strong in saying, we want this, let us go first. My understanding is Mayor Ballantyne has continued with that stance. Similarly, in Cambridge, we have places like the First Church and other leaders in the city of Cambridge who are willing to embrace this. So, yeah, I'm very hopeful that we can, pass this legislation, navigate any federal concerns, and then actually start saving lives in our community.
Do you think that the notion of a pilot program, which is, the bill intends to establish a pilot program, do you think there's going to be leeway to get around federal things? For example, it's a terrible name, but there's the what they call the crack house statute in the Federal Controlled Substances Act, which I know has been a barrier for a lot of people, specifically in Philadelphia, that they're facing a lot of challenges regarding that. In one, I think it's called the Safe House Facility. So I don't know. The establishment of a pilot program makes me think that it's intended for study. So maybe there'll be some leeway there.
I would hope so. I mean, I think it's a 10-year pilot, right? So that seems like it's, 10 years is a long time. So, I think that's a, useful way to frame it. I'd also add, in terms of federal prosecution, Rachel Rollins is the United States District Attorney for our jurisdiction. Clearly, I don't know that there's ever been a United States attorney as progressive as Rachel Rollins. So I would be hopeful that with her in that role, sometimes they, I think at that level they can sort of indicate, hey, we're not going to prosecute these certain laws in these certain contexts. So I would hope that that kind of understanding is being, advanced as well.
Right. That's nice. That's nice to hear that there's you believe that there will be that level of protection among some of the other protections that the bill establishes that, the Department of Public Health really needs to write in protections for these people that are setting up these sites during the pilot program so that they don't face this type of, action, criminal action. All right, well, that's we've all feel like it's been pretty positive up until this point, but I wanted to just do a little little tough one. Just how would you respond to concerns that some provisions of the bill might encourage drug use or enable drug addiction? Because I know that that's also a concern from community members and local officials in a lot of places.
Sure, I mean, I think it's certainly a valid concern, but I think we just have to look at all of the sort of evidence and history of this issue. And, there's been a prohibition, there's been a war on drugs. It's hard to really convey how spectacularly that has failed and continues to fail. And so, I think we have to realize there are a lot of people hurting out there. There are a lot of people facing a myriad of issues, whether that's economic crisis, health crisis, mental health issues, or other circumstances in their lives. And, and as I understand it, I think people have always used substances. I don't know that a notion or a goal that you're going to prevent humans from, seeking any kind of substance or drug is a rational or effective policy. And so, yeah, to answer your question, I certainly, recognize that, drug use can be incredibly detrimental and can cost people their lives. At the same time, there's so much potential with this concept. And I think really, if there, those who are worried about drug abuse, those who worry about drug use, those who are worried about what message we're sending with this, I think really ought to focus on the potential of this site, because, so many drug users or people who are struggling with substance use end up sort of in the shadows, in their own bedroom or in a bathroom at a gas station somewhere. And so essentially prohibition is driving people away from society, which then is breaking down and preventing them from establishing, more stronger human connection. And, from my point of view, that just sort of contributes to more problems and ultimately a lot worse outcomes. And so I think one of the great benefits of this concept is that it creates an opportunity for people who may be using certain drugs to foster more sort of consistent connections with people in their community. And I think in a lot of ways that can then open up new potential and new pathways, whether that means seeking treatment, whether that means, heading in a different direction with their lives.
That's one of the mandatory minimum entry-level requirements in the bill for a person who's seeking to be licensed to establish one of these safe injection sites, is that they have to provide a certain amount of educational programs. And as you put in, pathways, so they're referrals to prevention, screening, and treatment services, and then again, access to referrals for addiction treatment. So that's another thing that I'm absolutely happy to see that's included in the language. So I know we were talking earlier about how there was the very hopeful numbers coming out of the Vancouver facility where they had 0 deaths, but a big part of what the Department of Public Health's responsibility in establishing the pilot is to make a report to the legislature. So I just guess what other things would you like to see the pilot study to determine feasibility of supervised sites beyond death rates? I'm sure death rates is probably the most important one to think about. Like, right, are we reducing death? But I don't know, what factors do you think are important to consider when they're reporting to you on the feasibility of this?
I certainly think it would be, helpful and useful to know how people are doing. Certainly death is one metric, and that's certainly the most morbid of metrics. it would be good, I think, to understand along other dimensions, you know, whether that is seeking treatment, whether that is potentially getting sober, whether that's less life disruptions, would be important to understand, you know, and maybe there's opportunity for other sorts of analysis or study. I mean, as you mentioned earlier, you know, housing is a big focus of mine. You know, it could be interesting if you are collecting data on the clients of these future sites, you know, the potential to potentially extrapolate and track how other factors could be either contributing to someone having a worse outcome or a better outcome, you know? And so I would be interested to understand, you know, what are the economic factors, what are the housing factors and other relevant life factors that are in play for folks who may be, you know, taking advantage of this concept.
Very well stated. I won't take up too much more of your time. Is there anything else you want to convey to the public or to the UMass Boston MPA program class about the importance of a bill like this and the need for continued action addressing the opioid epidemic?
Well, first of all, let me just say I love UMass Boston. Big fan. I've been over there to tour the infamous substructure. They made me sign, you know, many waivers that, like, if the buildings all just collapse, you won't sue us because that's just how it is. But so yeah, no, I mean, thank you for you. You know, a big fan of the instructor of your class and was, you know, have always been grateful for her a lifetime of public service. And her
You're a
knowledge.
co-sponsor of her Roadrunner bill, if I'm not
Yeah.
mistaken, or yeah, right.
And her knowledge of Massachusetts rock and roll. So definitely wanted to say hello to everyone at your class and just thank you for highlighting this. You know, I think this is how we do the work. I mean, it's really about advocating, sharing knowledge, building awareness, and it sounds like in your class, really developing capacity to advocate. And so I salute you and reach out anytime.
Thank you very much, Rep. Connolly.
Thank you, Webb. Take care. We'll see you.